Hello, we are here to describe the bony landmarks of a right hip bone. So I will start with that. This is the ilium area here. This is the ischium, and then you have your pubis, which will be this area. Your iliac crest will be here on top. The iliac fossa is a depression below the iliac crest. Your iliac tuberosity is here. This is your PSIS, or your posterior superior iliac spine. This is the posterior inferior iliac spine, greater sciatic notch, ischial spine, lesser sciatic notch. This is the ischial body. The ischial ramus is this area here. The ischial tuberosity is this kind of like curved, thicker part on the bottom. Your obturator foramen is the hole underneath. Your pubic body is about this area here. The pubic tubercle is the tip, like your pubic bone. And then you have an inferior pubic ramus here and a superior pubic ramus here. We will switch it over to show the rest. This is the acetabulum. Labrum would go in here. You have your anterior superior iliac spine, or what is known as your hip bones, that you can palpate. This is the anterior inferior iliac spine. And a pubic symphysis would be here, which would be like a piece of cartilage type thing to connect the two pubic crests. Okay, thank you. Hello, we're here to describe the bony landmarks of a left anterior view of a femur. So this is the patellar surface here. The body of the femur is this area. Flip it over to the posterior side. You have the head, the neck, greater trochanter, trochanteric fossa is on that little edge there, lesser trochanter. This is the pectineal line. You will follow that down to the linea aspera, which is this kind of bony crest-like ridge here. You have the adductor tubercle here, medial epicondyle, medial condyle, lateral condyle, lateral epicondyle. And in case I forgot, this is the patellar surface. Okay, thank you. Okay, we're gonna label the bony landmarks of a left tibia. So you have the tibial tuberosity. This is the crest. Tibial plateau is this entire area here. You have the intercondylar eminence, which separates the two condyles. This will be your medial condyle here with an articular surface. This is the lateral condyle with a lateral articular surface. Then you go further down, and then you have the medial malleolus, which is this area there, the inner ankle bone. Thank you. Hello, we're going to label a few bony landmarks of the fibula. So you have the fibular head here up top. It kind of articulates right underneath the lateral condyle, a little bit posterior. This is the fibula body and the lateral malleolus. Thank you. Hello, I'm going to label the bony landmarks of the tarsals. So you have your calcaneal tuberosity. This is your calcaneus. What sits above that is your talus. You can probably see it a little bit better from this angle. Your talus here. This is your sustentaculum, the talar shelf. So following the talus, you have your navicular tuberosity on the medial side. Or sorry, navicular body here, navicular tuberosity is that kind of part that you can palpate. Your first cuneiform, your second cuneiform, your third cuneiform, and your cuboid, just most lateral, this one here. I think that is all. Thank you. All right, moving on to the metatarsals and the phalanges. So your tarsal bones end here, and they articulate with the base of the metatarsals. Then you have your metatarsal head, which is like your foot knuckles. Your first metatarsal is your big toe. Second would be this one here, third. fourth, and fifth is your pinky toe. These are the proximal interphalangeal joints and the distal interphalangeal joints. So your phalanges are here. These are your actual visible toes. Your metatarsals are right underneath them and the flat of your foot, and then the tarsals here. Okay, thanks. So I just wanted to make sure I didn't forget anything. The patella would be a sessile one that sits here and articulates here between the femur and the tibia. We also have the femur body is this area. And in case anything got cut off in the other video, you have the calcaneal tuberosity, the calcaneus, the talar shelf, and the talus. Thank you.